Hi, and welcome to the Wavelength, the mental health podcast designed to teach you how to live your best life at home and at work. In each episode, we explore themes and trends, innovations, and all other things shaping how today's people care for their mental health. I am your host, Dr. Sarah Adler, clinical psychologist, Stanford professor, and entrepreneur. And today I am so excited to be welcoming Dr. Jessica Jackson, founder and CEO of Therapy is for Everyone, to the podcast.
Thank you, Sarah. I'm excited to be in conversation with you I think when I was thinking about coming on, I'm like, we have so many good conversations all the time, and now we get to share them with other people.
That's what I was thinking too. I was thinking I have learned so much from our conversations. We spend a lot of time together at Therapist in Tech and outside as well. And I was super excited to be able to share our collective wisdom, especially your collective wisdom. I feel like our conversations are interesting, exciting, and super fantastic. And we should be able to share that. I agree. Couldn't agree more. If you do not know Jessica, Dr. Jackson, she is an award-winning licensed psychologist and mental health equity advocate. She, as I said, is the founder of Therapy is for Everyone Psychological and Consultation Services, which is a Houston, Texas-based mental health practice that provides expert care and health technology startup consulting services. And she is amazing. She is brilliant. And if you have any questions about anything that's going on and how to be a successful mental health startup, you should be talking to her without a doubt. Her research has focused on reducing barriers to treatment for underserved populations. She serves as an elected member of the American Psychological Association Board for the Advancement of Psychology in the Public Interest. She is the vice chair of Therapist and Tech and chair of the APA, American Psychological Association's Mental Health Technology Advisory Committee. And she was also recently appointed to the FDA's inaugural Digital Health Advisory Committee, which is super exciting and super important, especially given that we are just starting to see these new digital therapeutics coming out of FDA for behavioral health and mental health. And so they are incredibly lucky to have her wisdom and expertise. So as always, we start off with our interview icebreaker, although we barely need it because we know each other pretty well, but we like to do two truths and a lie. And so I will guess which is your lie, and we'll give the audience an opportunity to get to know you a little bit better.
So this is always interesting to me. I'm like, what don't people know? So I think this is a good one. So my two truths and a lie. One, I was almost a psychologist for a reality TV show. Two, I have written a book. Three, I have founded a nonprofit. Which one do you think is the lie?
Well, here's my thinking on this, which is I'm realizing the fact that I like to do this is because I'm actually very competitive and I like to play games. And so it sort of sets me up to get to play games and also have an icebreaker. So here's my thinking on this. I'm very wary of the I was almost, because you wouldn't set that up if that were a lie, as I was almost. That feels like, although you could be tricking me. So that I think that's true. I don't think you've written a book. I know you founded a nonprofit, but I don't think you've written a book. I know you've written book chapters, but I think I've written a book is the lie, but I'm not sure. That's going to be my guess.
Yes. That is the lie. I have not written a book yet. It's always the one that stumps people. I'm like, unless you count dissertation, which I fully think should have been a book, like the way we pour into that, but I have not written a book yet in life.
Well, I don't know what your dissertation topic was, but we turned my dissertation into a book. So I think we should do that. We should turn your dissertation into a book.
Yeah, I don't know about my dissertation. I think by the time I was finished with it, I was over it. However, I definitely have book titles that I keep in mind and notes. I'm like, one day I am going to birth a book that I think is, what the world needs. I just don't know that it's there yet.
Well, I cannot wait. I'm excited for that. And if you need an editor, I'm a good editor. So I'd be happy to edit your book when you're ready. Yes. All right, let's launch in. So tell me a little bit about, and actually, I don't think we've talked about this before, but what is Therapy for Everyone? Set Therapy is for Everyone, both in terms of your company, which is the name of your company, but also your general philosophy.
Yeah, so I think the two go together. I named my company Therapy is for Everyone because I do believe that therapy should be curated, it should be taught, it should be produced so that it is available for everyone. But I do not believe that everyone needs therapy, especially not all the time. But for me, so that's my philosophy. And for thinking about the work that I'm doing, I want to make sure that if tomorrow somebody's like, I'm interested in therapy, that there are options available for them, that it is created with everybody in mind. And that goes for products and services, that goes for how people are trained in cultural humility, that goes for even marketing, right? So I think about times that I've worked with individuals and organizations, and I'm saying, how do the images that you have on your website or your social media convey that you are open and welcome for everyone, right? Like they should want to come in. I think people should have the option to have a buffet. I call it like a buffet of options, whether that's peer-to-peer, whether that's coaching, whether it's therapy, whether it's an app, but it should be built with everyone in mind.
So the idea is really that we have this therapy, you're broadening the concept. You don't mean therapy necessarily, but everyone has access to appropriate mental health care, and everyone has access to being able to find something that works for them, and everyone should feel invited in, and not that some of these social factors are impeding our ability to take care of ourselves, to live our best lives.
Yes. That is a drum I feel like I bang all the time that goes into the mental health equity piece. I'm like, if you are building something that is not available or accessible for everyone, then who are you really building for? And often people will say, I'm building for this group. I'm building for employees. I'm building for Gen Z. I'm building for youth, all of these things. And I'm like, right, but what does that look like? And is it that anybody in that community or population you're building for, could they then use your product or your service and feel like this is for me?
Yeah.
I think about it, the analogy I give. So for those who have heard this analogy, because I give it all the time, but I think it's a good one. I think that therapy in general, not even just therapy, mental health services are like a pair of jeans. Anybody who's ever tried on a pair of jeans, when you go into the store, you see jeans that you like. You try them on. If someone's like, oh, you need to go get them tailored, you are more likely to leave them there. Jeans are a headache to get altered, right? The thick material, all of that. But when you find the right pair of jeans, you go back and you get different types of jeans from that company, right? So like there's no one who isn't loyal to it. Everyone has a favorite pair. When you say, oh, I like those, they're like, I get all my jeans from this place. Even if they're different types, you go back to that company because you're like, you made things that are for me. I don't have to buy it here and then take it and get somebody else to make it fit for me.
Yep. No, that makes perfect sense. And I completely agree with that. I find something that fits and then I buy it in 7 different shades and colors and I don't deviate, and then I cry when they all wear out. Yes.
Yes.
So I think that makes a ton of sense. It is so important, especially in therapy, to also feel seen, and as if the product that you are buying is actually doing it for you, because that's a huge component, right, of mental health treatment, is being seen.
Yeah.
Yes. It sounds like you're also talking about that being something there's a level of intentionality that you're describing when doing it. And I'm wondering if you can speak to, one of the things that you have, I think it's on your LinkedIn profile, is that you are an equitable technology advocate. So I'm wondering if you can tell me about how that fits in. What does that mean for people who don't know? And why is it so important to make sure you have one on your team, on your staff?
Yeah. So I don't know that it has a formal term. It's a term I'm using. And when I think about it, it's making sure that there's somebody who's advocating for equitable technology for everyone. And what that means, equitable, is that everyone has access. Another refrain I use a lot is, if you are building something for people who already have access, you are just giving them options. And there are millions of people who still don't have access. Mm. And so when I think about it, especially in health technology, I think it's really cool that we're building things using virtual reality, and people think about what's happening with AI and all this progress we're making. How many people still don't have cell phones, right? That's not equitable technology. So for me, when we are building things, there's always going to be a group of people left out if we're only looking at certain types of technology, or certain technology that only certain people have access to. So for me, when I'm advocating for things, I'm saying, let's make sure that we have something that is available. If someone maybe doesn't have the internet, is there another way for them to use this resource? Or we are building lots of things thinking about using AI, but what about people who are still trying to figure out Google? Like that definitely happens. I mean, I have conversations with my parents often where my mom's like, how did this happen? Or how did it know this? And I'm like, AI is maybe not necessarily what she's looking toward, you know?
That's right. How do you sort of reconcile that with, you do a lot of consulting work and in your employment have done a lot of work to support technological advances and using technology, using digital in mental health. So how do you sort of reconcile that with the fact that, yeah, there are still people out there that don't necessarily have cell phones? And how do you see your role in that? What are some of the pros and cons in kind of designing?
I see my role as making sure that we're aware and thinking about additional things that we might be able to build. If somebody is launching a brand new product, for example, and they're saying it's only available via mobile, having conversations, can you stream it? Is it downloadable? Because that means somebody only needs to have internet at certain points if it's something they can download. If they always have to have internet to have it, are there parts of it that they can use that are not connected to the internet? It's kind of like Google's offline. Yeah. Right? Can we still create something that other people can have access to? If we cannot, I think it is important to acknowledge that we are building for a very specific segment so that when we were advertising, we were thinking that. I think about when I was working as faculty, I was working in a hospital when COVID first hit, and everybody thought telehealth was going to be the savior. It was helpful for a lot of people. I would argue it was helpful for a lot of people who already have options. The number of people who were still coming to our clinic because they did not have a cell phone. People forget that there are people who still buy minutes. They were like, I'm not willing to put minutes on my phone for a whole therapy session when I can use a bus pass and come in. That's cheaper for me. Yeah. Right. And so for me, the reconciliation is having that conversation and then thinking about, well, what else can we offer as a team? Maybe everyone can have access to their app, but they can have a website that has some resources on it, right? I've worked with companies where that is something that we've been able to do. Here's a website where you can access some resources, even if you don't have access to the app, so that there's still some way that we're still improving access for people.
You know, it's funny because you know me, and I sort of preach all about access to care. And then I've basically gone and built a product with Wave that is not wholly reliant on internet access, but you need internet access to download it. You can actually use it offline. So I feel like we've checked a box on that, but it's actually making me think really carefully about how can I say that I'm a messenger of access if I'm not actually thinking about folks who don't have a cell phone, folks who don't have an app. How can they best leverage the information that we're providing and the intervention that we're providing? And you're giving me something to think about. I know we have some content on our website, but I'm thinking maybe we need to be a little bit more intentional about that.
The thing is, we can't solve every problem. And that's not what I'm trying to tell companies when I work with them. Like, you don't have to solve it, but can we push ourselves a little bit more? So even what you're talking about, is there a way that maybe Wave does incredible work? It might be once a year, there's a way we partner with one organization and teach them some skills to use that year. So over time, we're still having impact in communities for people who may not have access. So it's a both and. We need to be building and thinking about the future. And I just want to be mindful, that's the advocacy part, that we don't get so far ahead that we've left behind a whole population who still can't access the things that have been built.
I think that is really, really smart. And it's not that I have to necessarily go and throw the baby out with the bathwater, but I do, if I can build it in to my model to make sure that I'm living that value of access in a real way. I think it's really, really important. And it sounds like there are many, many ways to do that in different kind of varying degrees and varying steps. Okay, you've given me something to think about, as always, and something actionable that we can do. So how, in terms of, I know you spent a ton of time in digital health, and you have kind of, and part of your, I'm even just like looking at your bona fides and all of the different people who want you on their committees and on their boards. And I'm thinking about kind of some of the pros and cons of having technology integrated into behavioral health and what that means. I'm thinking a lot about patient safety. I'm thinking a lot about data. given your kind of newest position as the digital health advisor for the FDA, how is the world, where are we going in terms of issues of regulatory and compliance? What is happening directionally there, and how do you think that kind of feeds into the work that you've done?
Yeah, so I think, speaking from my personal professional experience, not, representing the FDA, I don't know what those policies will look like, but I'm glad to see regulatory bodies, not just FDA, FTC and others, who are thinking about what do we put into place. Because I think people are building some extremely innovative and amazing things. I have my mind blown on a regular basis when I see something. I'm like, oh, that could be so helpful. And I think there's a lot of companies who are building without doing the proper research about can what they're building be used. To me, what we're seeing in technology is a lot of community-based participatory research. The reason that came about is because people were creating interventions for communities and never asking those communities, what do you need?
Right.
Let me gather data from you, and then here's what I think is the best thing, and that we're just going to put it in the community. CBPR came about because it's like, how do you collaborate with the community to figure out what they need? So not only are you taking data, but you're giving something back that's actually functional for them.
Right.
That is what I see happening in technology. I don't know that people are necessarily asking, and it's not functional. It reminds me a little bit of when Instagram changed their algorithm, and so things are no longer in order. And I saw all these posts, and people are like, who asked for that? Like, who asked for them to take things out of order? I see that sometimes. People build things and that's amazing, but who asked for this? Like, which clinician is going to use it? And sometimes, with the best of intentions, people are coming in and saying, here's what's wrong with healthcare. This is why it's broken. Here's how I can fix it. And I'm curious, have you spoken to the people in healthcare to understand why it's like that? Is there a law or a regulation, some compliance thing that needs to be met, which is why that exists? Because you might have built an answer that cannot be used because you didn't meet those specs.
Yeah, no, I think it reminds me a lot of, I'm in Silicon Valley. It reminds me a lot of what we see out here is people building technological solutions to problems that don't exist, and then really annoyingly and irritatingly get funding for them, and then end up I don't know, I'm thinking of, there's so many different products out here that get built, and we're like, no one, who asked for that? There's a mental health company, and I will not name names, that decided to build an entire product without ever talking to their users, and it literally doesn't get you. They're a services company that has a really great service arm that makes a ton of sense, but they've built this technological analog because they hired a fancy product person, and now they've built something that no one wants, no one needs, no one uses. It's going to interfere with their business in the long run. So I think that makes a ton of sense. It's and I love that this has come out of research also, right? Is our idea that you actually have to be able to give back to the communities that you're building for, which is sort of a no-brainer on that one. But that's it. That's exciting. How do you think the work that you do with APA and the different, I won't get too the weeds on it, but the work that you do with APA, the work that you're going to be doing to set some of these rules, boundaries, thinking is going to impact what's happening in terms of all the innovation?
My hope is that we will be bringing the behavioral health conversation to the table, but elevating it.
Okay.
I think people think about behavioral health. Often we are thinking about it from an intervention standpoint of we're already in crisis. What do we do? And I'm like, I'd love to see us thinking about it from a prevention standpoint. But also, kind of a question I ask myself all the time is, when you come into a room, are you changing the room or is the room changing you? Oh. So I think about I'm coming into spaces, right? It's to me, it's a reminder of what is your role? It's a both and. I want to come into a space and learn from the room, but I want to help change the room. I want to be changed, but I want the conversations. That's why I said elevated. Yes, we're talking about behavioral health, but how are we thinking about it in a way that helps us to move forward? How are we thinking about some of the nuts and bolts? I think not just the nuts and bolts, but even how are we thinking big picture? A lot of people are building for today. What do we think mental health is going to look like in 5 years? To me, we're building a lot of things that feel like we're putting new wine and old skins. How about we reimagine mental health? And sometimes that's an elevated conversation. Does therapy have to look like we sat down for 45, 50 minutes and just talked? Or can we think about something that we haven't even conceived yet and build products and services for that? And that's what I mean by elevating the conversation. How do we take it further than what we've already done since Freud?
And that's actually what excites me so much, and what I love so much about our therapist in tech community is I feel like we have found like-minded people to have those discussions, where some of the other institutions that I'm involved in, they are so wedded to this idea that mental health is acute phase. It happens when someone is in crisis and shows up, and that it is really limited and constrained by these 45, well, now half an hour, depending on what insurance pays for, but 45 to 50-minute sessions. And I think you are so right. And I think it's such an important comment to make, is that there's so much we can do if we stop looking at it as only dealing with mental health as an acute phase care, rather than looking at it more as a chronic, something that we can prevent downstream, we can maintain after, but it sort of opens the aperture and opens the ability for us to really do really cool, innovative things. So
absolutely. I do really cool, innovative things that people can actually do. I think about even licensing. For the state of Texas, like they do these office hours, and I was asking questions about like, what are we thinking about for technology? Because most people don't realize your clinicians' ethics codes and what they have to follow are part of the state law. So it's not that people don't want to do things. They don't want to get in trouble. So again, asking that question of our behavioral health council, what are we doing to help support clinicians? And literally the answer was, it's on our radar, but we haven't done anything. I'm like, right. So there's a mismatch, right? The largest states. So it's a mismatch. People are building these things, but we still haven't thought about what does that look like on a state level, on a national level, on all these levels, for people to feel comfortable and say, I'm not risking my license to try it. Right? And even things that feel minor, people are like, I'm not going to try that.
I feel like that is, okay, you have to come back and we have to have a whole nother half hour just on that and licensure, because that is a ball of wax that I feel like needs to be, it doesn't get talked about as much because, and especially you and I are both licensed clinical psychologists. It is not all of us as a body who will actually talk about the idea that licensure is something that divides and something that actually keeps us from being innovative and being growing. I know why it's there. I know why it's important, but there's this like miscue almost that people think and a lot of psychologists think that just because you're licensed, that means suddenly you're providing good ethical care, which is like a whole bunch of BS. Okay. We are at time. That went really fast, really super fast. Will you come back again and talk more? I feel like we've just scratched the surface. I feel like we've got a lot more to talk about.
I would love to come back and chat more. For those who are listening, I'm going to just leave y'all with this gem, because I do want clinicians to be innovative. I do want clinicians to try things. And so in that balance, I do encourage anybody who's listening, not just clinicians, any mental health professional, to really focus on the difference between risk management and liability. Those things get so confused all the time. So I'm like, if you don't get anything else from this and you think about innovation, encouraging people to separate those two to really think about what they can do.
I love that. I love that so much. And if we can stop thinking about protecting our licensure, protecting ourselves, which I understand why we need to do that, but thinking about it, as you said, in the both end.
Yeah.
Yes. I love it. All right. Thank you so much, Dr. Jackson. And thank you all for tuning into the Wavelength, your guide to mental health at home and at work. If you enjoyed this episode, don't forget to leave us a review and subscribe wherever you get your podcasts. And if you're looking to actively support your own mental well-being, be sure to download the Wavelife app. It is currently the only digital solution that both has a evidence-informed, evidence-based app, as well as highly, highly trained health and wellness coaches, as well as therapists, to really support personal growth and live the life you want. Our music is from Gold Roses from Cloud System. And join us next time as we continue to navigate the highs and lows of emotional well-being for your life and work and home on the Wavelength. And just one last plug really quickly. If you are a mental health company, if you are trying to build a product, if you are trying to increase access, you need to be talking to Dr. Jessica Jackson. So go find her on LinkedIn, and all of her credentials and all of where to find her will be linked as well into our podcast notes.